Hi everyone, welcome back. I'm Lori Geiselman. We are now in the final topic, which is cultural competence. And I look forward to discussing this more in class, but for now I'm just going to cover a few concepts around cultural competence, that of the individual and an agency or healthcare setting. How do we know if we're a culturally competent individual? We have the ability to maintain awareness and respect for the beliefs, language, interpersonal styles, and behaviors of individuals and families. Also, culturally responsive staff respond more effectively to our clients' psychological, communication, and physical needs. Some starting points. It's important that we make sure we take time to understand ourselves and recognize that our own cultural identity filters and directs how we think, feel, and behave. So whatever our belief system is, whatever that internal manual is that we talked about in the last video, that instruction book for how we're supposed to believe and interact and what our expectations are for us. And this really is the foundation for understanding others, is to understand yourself first. Here are some questions you can ask yourself. Do you consider the biopsychosocial as separate entities or as part of the whole person? How do you define illness and healing practices? What are acceptable behaviors for managing stress? And how do you express emotions? Or how do you express when you're upset? What words do you use to describe symptoms? Who would you turn to for help if there were a behavioral health crisis in your life? Do you believe that substance misuse is acceptable? If not, and you work in an agency that has clients coming in with substance use disorder, then the question is, how might your lack of acceptance impact that person? And that's how we'll kind of tackle the questions when we get together as a group. Is there a disorder that you would be very uncomfortable telling others about? And the last one, are there certain health problems that you see your community struggle with? You want to work on your ability to acquire knowledge of clients' cultures. Cultural competence is not just learning facts, speaking another language, or being able to recognize features of a cultural group. It really requires us to get to know the person and to take the time to figure out those nuances, those multi-layers that make up each person. It's an ongoing process to become culturally competent, and it requires a commitment to understanding the role that culture plays in behavioral health. And this is something that we all should be working on, and that we're never finished. There's not an I'm done, because we're going to continue to meet new people, and they are going to bring a new set of questions to the table because they're a brand new person. This stairway that I created is showing cultural competence as an ongoing process. It was a kind of a straight grid, and I turned it into stairways because I wanted us to feel, as we were going through the stages, that we were getting better and better, and so, or getting higher and higher. And I mean that in, we're elevating practice. So stage one is cultural destructiveness. This is where culture doesn't matter, staff interact with clients with biased views, and they don't take the time to think about how this impacts their client. The next stage is cultural incapacity. We're still overall ignoring the relevance of culture. There may be staff who are aware of the need to consider culture, but don't think that they have the knowledge or the authority to do so. So the staff don't feel empowered to elevate that practice a little bit. And then we come next to stage 3, which is cultural blindness. This is when staff have a belief that there's no real differences among individuals or across cultural groups. They believe that everyone is treated the same and there's no need to focus on an individual's cultural difference. We will have a chance to talk about this more. It's rather an interesting stage and very recognizable, and actually we can relate this to some other areas of disparities and isms. I won't say which isms, but there's a few. And like I said, I don't want to ruin the conversation. We'll get to talk about this in class. And then stage 4, cultural pre-competence. This is where staff recognize that culture is important and it's going to make us better. But the problem is that we do not have the knowledge and skills yet to really do anything differently. And so we're poised now to become that agency that's going to be culturally competent. These are staff that are culturally responsive. They see the positive difference that cultural competence makes, and it impacts our clients in a positive way. And we being staff, remain committed to maintaining our cultural competence and our awareness and our openness to learning, and understand that there's no finish line, as I said earlier. Attitudes and behaviors of culturally competent staff. How can you tell? This is a grid that gives us some behavior examples of respect, for instance. So a culturally competent staff with an attitude of respect explores, acknowledges, validates the client's worldview. They take time to understand the client's needs and expectations, and they make an effort at communicating. This grid right here actually goes nicely hand in hand with, I'm going back because I just want to show you, work on the ability to acquire knowledge of clients' cultures. So if you're wondering how that looks, this is a good slide to use as a kind of a guide. Acceptance, maintaining a non-judgmental attitude towards clients and considering what's important to them, being sensitive to their negative experiences, exploring their identity and what it means to them, and tailoring care to meet cultural needs of the client. Then we've got equality, commitment. And so this is where we have to address bias as it occurs in the workplace. So when we see it, there needs to be like a timeout, almost like a safety stop, where we kind of explore what went wrong there, or what could we do differently next time. And then openness, that is all about continuing to learn. And if you remember to bring this back to your professional values, one of your values was to make a commitment to ongoing learning, being the best you can be, kind of thing. And this falls into that category as well. To be at the top of your game is to be culturally competent. Some tips for communication: to slow down, use plain, respectful language. Maybe show or draw pictures. If you have a visual learner, this could be really helpful. Limit the amount of information provided at one time, and use teach-back method. That's as simple as asking someone to explain to you what you just reviewed with them, and create a shame-free environment that encourages questions and participation. The client should always be viewed as the most important person on their own medical team. And be aware that the client brings strength and has a strength of support as well. That is their, members of their community, members of their culture, people in their family, that sort of thing. There's pride and participation in one's culture, culturally specific social skills, traditions, knowledges, and experiences that they bring. Are they bilingual or multilingual? Such a talent. And any traditional religious or spiritual practices, beliefs, and faith can be a great strength, especially in medical settings. And we'll talk more about that in class. I'm going to take a breath. This presentation was developed by Professor George Ladd. I hope that these concepts weren't too difficult. Again, you know, we're trying to just give you a little bit of snippet, things to think about, and to be prepared to come to class to talk about more later. And then just remember to take your quiz. And I thank you so much for your time and look forward to seeing some of you soon.